kids with autism kind of have a special place here in my mind because, you know, these children don't have a voice. I mean, they can't tell you what's wrong. They can't explain how they feel. And so anytime we have children that come in here with autism, we make it a top priority to do everything we can for them. Dr. Strockman and I created something called the factor integration model of treatment for autism. And the reason why we call it that is because autism tends to present in many different ways depending on the child and depending on the child's history. For example, several factors have been known to contribute to symptoms of autism or even ADHD. Some of those factors might include heavy metal exposure or toxicity. Some might include neurotransmitter imbalances that we have to test for. Some may be very frank vitamin or mineral deficiencies. And when you take all of these factors into account, we can create a treatment plan for that specific child that's specific to the factors for their specific case. You know, birth trauma is also a big factor, for example. I mean, what if, you know, that child's mother may have had to have an emergency C-section, or maybe, you know, the child was breech, or, you know, whatever happened, a lot of birth trauma may contribute to dysfunction in the upper neck. Anybody who has seen a vaginal delivery, for example, knows that there's a lot of force and a lot of exertion put on the infant's neck. And that force oftentimes can disrupt a lot of the musculature and ligaments in the top of the baby's neck. And when that happens, if that's not addressed right from the get-go, it can cause a lot of symptoms even up into adulthood. We see it very oftentimes even in cases of idiopathic scoliosis, for example, that they have certain signs of symptoms on x-ray of birth trauma injuries. And so what we try to do here within our factor integration model is to take all of these factors into account and address them specific to that child's needs. You know, there are a lot of up-and-coming alternative type treatments that offer a lot of similar types of laboratory assessments, treatments, outcomes, etc. But what we like about the factor integration model is that it can be individualized per patient. One of the things that we often see in things like certain alternative medicine, the DAN network, bionutritional care, some other things, oftentimes we see certain practitioners of these modalities get a little bit too much into a cookbook mode or a recipe mode where every child essentially gets put on the same or very, very similar treatment plan. And yet not every child has the same expression of symptoms, or not every child has the same history. For example, you know, one child's parents might come in and say, we didn't notice the symptoms until about 3 or 4 days after they had an MMR vaccine, where they had their vaccine, they spiked a really high fever, and then they were never the same since. Sometimes parents will come in and they'll have an entirely different story to tell. For example, maybe, you know, they were involved in a car accident. The child was in a back seat in a car seat, but the child still suffers a whiplash type injury to the neck, and then they notice that the child hasn't been the same since that car accident. So depending on what factors are present for each individual child are going to determine for us here which type of specific methods and treatments and laboratory assessments are we going to use. So I think having the factor integration program here is very exciting because, again, we can get results typically very rapidly, and parents notice changes very rapidly in these children when the treatment plan is really custom tailored to their specific child.